So today we will be discussing the three major sources of pain and the centers that they focus around in the human body, all right? So what we have here is we have the foot, the hand, and the head, okay? These are going to be the three main sources that pain is reported in the human body, about where that is localized. In the foot, there's a huge map of nerves, there's a huge network that you have to become aware of. Most doctors will not teach you is right in between these two toes here. You must check right here in between these toes. If there's any swelling, you should definitely send them to a specialist, okay? Now next on the hand is a very important thing. The head tends to get all of the attention. Most people tend, geez, we must have left these in storage a while, it's kind of warm. The head gets all of the focus because people think the nerves in the neck, they are worried about trauma to the head, injuries, things of that nature. And the head is important, but the hands are something that should not be overlooked, okay? For thousands of years, in many different cultures and schools of medicine, the hands have been consulted when it comes to nerve pain, and that's because you will find different responsive areas on the hand that correlate with the rest of the body. You can even relieve a lot of headaches, migraine, and pressure that is reported in the head by massaging and releasing some of these different buildups of nerve tissue and blockages in the hand. So one of the first things that you want to do when a patient comes in reporting, when they report a headache or any kind of problem with their head, check their hands first, okay? So the first thing you want to check is that pain center between the toes, okay? Give it a nice poke with whatever instrument you use, and if they have any kind of pain there, send them to the specialist. If not, you're going to move on to the hands, okay? So you want to remember this order: foot, hand, head. That's the order that you go through for the pain, all right? The head is the last thing you check, all right? Now, if you get through the hand and they've reported no pain in any of those centers, then what you're going to do is you're going to go for cranial relief of pressure. What you want to do is you'll see along the neck here, there are going to be nerves that bunch up, especially at the base of the skull. So what you want to do is you want to take, you're usually going to have a choice of two different reflex hammers. You know, these are the ones that you traditionally use for the knee, but you'll find a heavier one is going to give you the result that you want here. So you're going to provide a series of small taps along the surface of the head. This is going to let you see, if you've gone grocery shopping, people, you know how you tap on the edge of a melon. You can actually use a similar process here. I don't seem to have my stethoscope, but if you listen to the other side of the head as you provide taps, that resonance is going to indicate whether or not you're dealing with an additional buildup of fluid or not. Now, if you hit that tap and what you get isn't that low, dull kind of bouncing sound, if instead you get something that's kind of a sharp, higher pitch sound, then what you're going to want to do is tell the brain and tell the cranium to release some of that excess fluid. And the only way to do that is with a very sharp tap right on the back of the head here, okay? So I'm going to demonstrate this. If this were a normal patient, you'd want to start working your way up on the intensity, but because this is a demonstration head and a dummy, I'm going to show you guys starting out at full strength here. And what you're going to do and how you're going to find this is you're going to start by placing the end of the hammer right on the tip of the hairline, and then you're going to flip the hammer up, and right where the base of the hammer lands on the skull is where you're going to provide that tap, okay? And again, it's going to be a full force tap. We're going to provide just like this: 1, 2, and then just